Hello, friends. Welcome back to Radio Express. I am Paresh Naik, ENT surgeon with special interest in rhinology, skull base, and head and neck. Today, let's see what do we have. We have another interesting scan. Like all our other videos, I try to keep the videos short as the retention span is less than 20 minutes. We are going to have a look at another interesting scan, and this particular finding is often missed. This is a CT scan of Mrs. ABC, who presented with bilateral nasal discharge and facial pain. Endoscopic examination turbinates were enlarged. So, here is the CT scan. I am going to repeat the same statement again. White is bone, black is air, anything in between is not bone and air. So as we move further, the first thing we start noticing is the eye on the left side. Okay, so what does this mean? This means that when the patient was having its CT scan, maybe the patient was slightly turned towards one side. That is, the images are rotated. Okay, so in such cases, you may have a little bit of asymmetry, but you don't need to worry about it. So, as we advance, the first thing that we see is the frontal sinus. Quite obvious. And there is a septa dividing it into right and left. We move further and you can see the inferior turbinates. I'm going to use this ellipticals to identify or point out the structures that I'm talking about. So these are the inferior turbinates. As you can see that the left eye is almost completely seen. However, we have not even started seeing the right eye. This is the thing I was saying about the person may be slightly tilted and we have got a twisted image. You don't need to worry about it. As we are moving further, that is from anterior to posterior, that is from front to back, the next thing that you can see is this. This is the nasolacrimal duct. Can you see how this traverses and opens in the inferior meatus just underneath the inferior turbinate? So one of the things is whenever you want to do any surgery to the inferior turbinate out fracture, one of the methods of doing the out fracturing is you first infracture and then out fracture. That is, you place your Hill's elevator or Frere's elevator in this area, push it this side, then put your elevator in this area that is medial to the inferior turbinate and lateral to the septum and push it outwards. By this movement, you're fracturing the inferior turbinate. We should take care not to cause much injury in this area. Nothing happens at that time, but later on it can cause fibrosis and obstruction. So that's one finding. Now, I'm just going to focus on this important thing. We did mention that as the person is slightly twisted, there is asymmetry. However, I want to bring at this level of scan and see. Can you see the right maxillary sinus compare with the left? Don't you think this sinus looks like a pediatric sinus? Although this is an adult scan. You can also notice this ledge of the inferior turbinate. So it is way far from the body of the inferior turbinate. This ledge is almost always present in this finding. The medial wall of the maxillary sinus is pushed laterally. So for junior surgeons, I would like to add this point. Whenever you start seeing any scan, okay, I'll give you a small tip. Even if you don't know anything about a scan, you don't know any details about any scan, just have a look on the other side. Compare the symmetry. Almost always you will notice that there is something unusual. Like in this case, you see, this is unusual. Also, you can also notice this air cell as compared to this part, it is unusual. Okay, you see over here, you can see the optic. Over here, you can still see the eye, and that way you can notice that there is slightly rotation of the head. Compare the scans with the other scans, okay, and compare with the other normal findings. Almost always you will be at least be able to identify that there is something abnormal. So if your senior surgeon asks, you can at least say, okay, I find this is abnormal. The right sinus looks smaller than the left side. That's it. So this is the classical case of maxillary sinus hypoplasia. This part as compared to this is smaller. I'm going to roll back to a couple of slides, and here I want to show you this area. Okay, we are looking towards the infundibulum and hiatus seminularis. Although in this area, there is a slightly haziness in the mucosa, we would have been able to appreciate that there is narrowing of these normal structures. So, maxillary sinus hypoplasia, what do we have? We have something called as Bolger's classification. The overall prevalence of the maxillary sinus hypoplasia is around 10.4% as per the old literature. But again, I would like to say that this is understated because not everyone in the general population undergoes a scan. So only people who are symptomatic or they come to the clinic, they will undergo the scan. So I think this is underrated. Now, what are the types of the Bolger's classification? We have type 1, type 2, and type 3. These are all based on the uncinate process. In type 1, the is characterized by the normal uncinate process and a well-defined infundibulum. Okay? There is mild sinus hypoplasia. So there can be, so what you can do is at times you can measure this diameter, this length from medial to lateral wall, and you can compare from on the other side. That will be the type 1. Type 2 is characterized by the absence or hypoplasia of the uncinate process. So in this scan, if you can see, this can be a type 2 Bolger's classification maxillary sinus hypoplasia. I will repeat, it is characterized by absence or hypoplasia of the uncinate process. The infundibulum is ill-defined. There can be soft tissue density around the sinus. So this will be type 2. Type 3, I have got one more interesting scan which I will show you in the one more YouTube video. Type 3 is characterized by absence of uncinate process and a profoundly hypoplastic cleft-like sinus. So we have understood this. Now, why is this classification important, or why this finding is important? So imagine one of patients like this undergoes a surgery, and you have not noticed this finding. You take your instrument and then try to do a middle meatal antrostomy. Take a backbiter and try to remove the uncinate. After going that, if you're using a suction or a debrider, you are directly exposed to the medial and the inferior wall of the orbit. Okay? And imagine if one start using 45-degree Blakesley or micro debrider, the next thing will be, boom, orbital fat. You don't want to have that. We need to know this scan and know this finding to avoid medial wall or the inferior wall or by dull injury. Okay. The causes of the maxillary sinus hypoplasia can be trauma, infection, uh, surgery in childhood, irradiation. If someone is having cancer in their pediatric age group and that time they get radiation, these structures won't be developed. It is also seen in congenital deformities and syndromes like Treacher-Collins syndrome. In Treacher-Collins syndrome, it is associated with unilateral maxillary sinus hypoplasia. In this condition, that is this particular case, the patient had multiple courses of antibiotics and nasal sprays, still was symptomatic, and hence that made me think, oh, I should get a scan done to know what it is. Because many times what happens is a patient is not having a chronic rhinosinusitis, but is having a benign lesion, a benign tumor, maybe like inverted papilloma in the nose, or a fungal condition in which the osteums are blocked, and that may give rise to runny nose. Well, the patient doesn't understand. The patient will come and say that, oh, I'm having runny nose. We'll have to know what the finding is, because you are going to give medical management, optimal medical management, and then look that why it's not getting treated. Maybe think about scan then. So what is the today's teaching point is that when the symptoms are exaggerated, they are more, and when the symptoms are still persistent with medications, please consider a CT scan. That was today's quick video session. Hope you have learned something different. Thank you so much, and please do not forget to subscribe, like, and write your comments below if you want any further suggestions, or if you have any doubts, or if there is something controversial or you think I have said something wrong. Please write it down. Many thanks. See you next time in the next video.